Okay, so I'm going to be talking about nutritional needs for low birth weight infants. Low birth weight, according to the National Cancer Institute, is a term used to describe an infant weighing 5.5 pounds or less when they are born. Low birth weight is also another term. Another term that can be used is premature. Infants have an increased risk of serious health problems when they do have low birth weight. Smoking cigarettes, being exposed to secondhand smoke, drinking alcohol, or taking certain drugs during pregnancy can increase the risk of infants having low birth weight. So, what are the causes? Premature, which means the baby has less time in the uterus to grow and gain weight. Most of the baby's weight is gained during the third trimester. Um, Intrauterine growth restriction doesn't allow the baby to grow well during pregnancy because of problems with the placenta, the mother's health, or the baby's condition. Premature babies with intrauterine growth restriction are very small and physically immature. Babies can have IUGR and be born at full term, they are just physically mature but weak. So, who is affected? Any baby born premature is more than likely to be small. African American babies are 2 times more likely to have low birth weight. Teen mothers, usually younger than 15, have a much higher risk. Moms who are giving multiple birth, twins, triplets, etc., are at an increase for low birth weight because they are more often than not premature, anyways. Over half of twins and other multiples have low birth weight. The mother's health, babies exposed to drugs, alcohol, cigarettes are often more likely to have low birth weight. Mothers of lower socioeconomic status are more than likely to have poor nutrition during pregnancy, inadequate prenatal care, and pregnancy complications, which can all contribute to low birth weight. So, why is it a concern? So, babies who are born with low birth weight can have low oxygen levels, inability to maintain body temperature, difficulty feeding and gaining weight, infections, breathing problems, neurological problems, gastrointestinal problems, sudden infant death syndrome, also known as SIDS. Most all low birth weight babies need specialized care until they can gain weight and are well enough to go home. Survival of infants with low birth weights depends on how much they weigh at birth and how much they gain, like how much weight they can gain when they are born. And the smallest babies have the lowest survival rate. So, prevention of low birth weight. Now, tremendous advances in healthcare allow for a lot more babies to survive. Great prenatal care, maintaining a healthy diet, the mother gaining weight during pregnancy is very important, and also avoiding alcohol, cigarettes, and drugs. So, infant nutrition. In their first year, babies triple their birth weight. In order to grow that much, they need a lot of nutrition, more than what they need in their life. Breast milk is the best source of nutrition, but formula is also a good alternative since it contains cow's milk and it will help them gain weight. An infant who has low birth weight can be healthy, they're just tinier than most infants and need more nutrition. Um, 2 times more nutrients than the full term babies. Nutrients and vitamins. Calcium, which helps bones and teeth. Fat helps energy, brain development, skin, hair, and protects against infections. Folate helps cells divide. Iron, protein and carbohydrates. Zinc, nutrients. Nutrients in the formula contains iron, protein, calcium, zinc, carbohydrates, vitamins A, C, D, E, and all the B vitamins. Doctors recommend that babies get vitamin A, B1, B2, B3, B6, B12, C, D, E, and K. So, calorie requirements for low birth weight infants. According to the American Academy of Pediatrics, the metabolic rate of low birth weight infants is lower than that of full term infants during the first week. but it reaches and exceeds that of the full-term infant by the second week. Daily calorie requirements reach 50 to 100 kcals by the end of the first week and increase to 110 to 150 in subsequent active growth. Calorie intakes of 110 to 150 a day enable most low birth weight infants to achieve satisfactory rates of growth. Protein requirements hasn't been precisely defined, but between 2.25 and 5 grams a day of cow's milk. Breast milk only contains 1.1 grams of protein or less per deciliter. The feeding of human milk to premature infants was preferred until 25 years ago, when studies then showed that premature infants gain more weight when being fed cow's milk. Fat and carbohydrate intakes. So the ability for low birth infants to absorb fat is really poor. This limitation is associated with liver immaturity and decreased bile salt synthesis, and it is found to a lesser extent to full-term infants during the first few weeks of life. The utilization of carbohydrates by the low birth weight infant differs slightly from that of the full term. Intestinal disaccharides develop early in the fetal life and reaches full growth by the 6th to 8th month. Low birth weight infants can adequately digest disaccharides, although there is some evidence that lactose digestion may not be fully efficient for the first few weeks. So that's why doctors recommend formula instead of breast milk, because it allows the baby to gain more weight. So the conclusion is that the optimal diet for the low birth weight infant may be defined as one that supports a rate of growth approximating that of the third trimester, since that's when most of the baby gains weight anyways. Cell division and growth of all the tissues in the infant should proceed at a rapid rate. Failure to continue growth could result in serious and lasting consequences.